across the UK. Fourthly, there are operational challenges, including maintaining that testing and in the PPE, and that these are all in hand with supply able to meet future demand. But I think the fifth one is the one that we all need to keep in mind as we go forward. We have to be confident that any of the adjustments to the current measures, which have worked so well to help everyone keep safe and to manage the peak and keep the NHS working through, but those current measures need to be very carefully adjusted in order that we do not risk a second peak of infections that overwhelms the NHS. Next slide, please. So how have we been doing? So we've often seen the transport use change, and I know we've had a little bit of concern perhaps that motor vehicle usage has flipped up a little bit, but we do know from other evidence that in fact the number of social interactions has stayed very low. And the fact that the R rate, the transmission rate of the disease is down, suggests that all of these fit together. So a very significant drop in transport use accompanied by very good adherence to social distancing. Next slide, please. As you can see here, and as the Secretary of State has said, we have had a massive increase in daily testing, and you can see that as we've gone forward. So over 105,000 tests in the last 24 hours up to 9 o'clock this morning. That will continue. And if we look at the next slide, we can see how that is now panning out between the NHS testing in blue and the orange testing, which is the growth in the wider testing capacity. Now, obviously, as the number of cases requiring clinical care in our hospitals drops down, and you can see that in blue, the orange testing pillars are rising up. That is despite the fact that actually in the NHS, all patients coming in to the NHS now are being tested. So there's likely to be a drop-off because of the reduction in the number of positive cases, but there will then start to be a bit of an increase again in our blue pillars as we consistently test through hospitals. Next slide, please. This is the slide, I think, which makes it very clear what has happened with our NHS capacity. This is a slide of the number of people in hospital with COVID-19, and you can see that over the last week, the number has actually decreased by just over 13%. And London, which was clearly very significantly affected, has now come back down to the sorts of levels that are seen in other areas. Of course, that never means that people on the front line are not continuing to have to work really hard, but it does demonstrate that the pressure on the NHS is now moving down, and we recognise that in the fact that some NHS services are now planning to ramp back up again. Next slide, please. So again, this reinforces that message. So obviously the sickest patients will require critical care, and this is our critical care bed use with COVID-19 patients. And again, in all countries in the UK, we've seen the rise as the peak in the epidemic has moved on, and those case numbers now are starting to come down. Next slide, please. And then these are the sad deaths associated with COVID-19, and as we're now reporting, these are across all settings. The blue bars are the daily totals, and I think we are very familiar now with the fact that sometimes those individual totals can be recognised, the delay in some of the reporting, but the orange line, the 7-day rolling average, gives us an indication of just how the death rate is now starting to come down very gradually and very slowly, and it's really important that we continue to practice social distancing and watch that come down still further. Next slide, please. And then finally, with all the difficulties that we have of comparing data globally, the UK data there in black is all settings, so this is as comparable as we can get with other countries. Eventually we will look back and see how that compares with different mortality statistics. But for the time being, I think that gives an indication of where the UK is, and hopefully that's now starting to flatten out. Thank you.
Thanks, Jenny. So